wounds. Definition of wound. It is an injury, especially one in which the skin or another external surface is torn, cut, or otherwise broken. It is a type of injury in which the skin is torn, cut, or punctured. This is an open wound. Or where blunt trauma or force trauma causes a contusion. This is closed wound. In pathology, it is specifically referred to a sharp injury in which damage the dermis of the skin. Classification: open wound, closed wound. Can also classify according to simple and complicated wound, also septic and aseptic wounds. So open wound, it is incisions or incised wound. Incisions, it is an injury that caused by a clean or sharp-edged object such as a knife or glass. Laceration is irregular tear-like wounds caused by some blunt trauma, and laceration and incisions may appear linear, regular, or irregular. And the term laceration is commonly misused in reference to incisions. Abrasions or grazes, it is a superficial wounds in which the topmost layer of the skin or the epidermis is scraped off. Abrasions are often caused by sliding fall onto rough surface. Avulsion, injuries in which the body structure is forcibly detached from its normal point of insertion. It is a type of amputation where the extremity is pulled off or rather than cut off. Puncture wounds caused by an object puncturing the skin, such as splinter, nail, or needle. Penetrating wounds caused by an object such as a knife entering and coming out from the skin. Gunshot wounds caused by a bullet or similar projectile driving into or through the body. There are two wounds, one at the site of entry and one at the site of exit, and generally referred to as through and through, or dangerous and open wound. The type of closed wound, contusions. This is more commonly known as bruises caused by blunt force trauma that damage tissue under the skin. Hematomas is caused by damage to a blood vessel that in turn causes blood to collect under the skin. Crush injury is caused by a grip or extreme amount of force applied over a long period of time. This is an open wound, avulsion. This is laceration, and this is lacerated knee. This is puncture wound infected at the bottom, and this is puncture wound from playing drug. The wound healing. There is phases of healing. First, hemostasis, and not considered as a phase. Second, inflammatory phase. Third, proliferative phase, and fourth, remodeling. This is the phases of healing. Upon injury, the skin, the complex of biochemical events take place. And within minutes post-injury, there is platelet aggregation at the injury site to form the fibrin clot. And this fibrin clot controls the active bleeding. This is the hemostasis. This is the first phase. And the speed of wound healing can be impacted by many factors, including the bloodstream level of hormones such as oxytocin. The inflammatory phase, the bacteria and debris phagocytosed and removed, and factors released that cause migration and division of the cell involved in proliferative phase. The proliferative phase characterized by angiogenesis, formation of new blood vessels, collagen deposition, granulation tissue formation, epithelialization, forming cover for the superficial layer, and wound contraction. And in angiogenesis, these new blood vessels are found or formed by vascular epithelial cells. In fibroplasia and granulation tissue formation, fibroblasts grow and form new extracellular matrix by secreting collagen and fibronectin. And concurrently, epithelialization that the epithelial occur in which the epithelial cell proliferate on top of the wound bed, providing cover for a new tissue. In contraction, the wound may be smaller by action of myofibroblasts, which establish a grip on the wound edge and contract themselves using a mechanism similar to that in smooth muffin. And when the cells roll are close to complete, they are undergo apoptosis. In maturation and remodeling phase, collagen is remodeled and then along tension lines, and the cells that no longer needed are removed by apoptosis. However, this process is only not complex but fragile and susceptible to interrupt or failure, leading to formation of non-healing chronic wounds. Factors which may contribute to this, like diabetes, venous or arterial disease, infection, or metabolic deficiencies of old age.